ahead, Linda.
Okay, I'm going to give you a brief overview, and then last week what we promised we would do is look at some modeling and what we look at for modeling. So first, the state announced they now have 22,783 cases. That's 1,279 up from yesterday. And I don't have the number of deaths, but I know that they reported another 205 deaths today. So let me show you what's going on in Ingham County via screen share here. So what we have is 240 confirmed cases. That is up 12 from yesterday. Yesterday we reported 4 deaths. We did get an additional death reported yesterday. However, we also found out that one of our earlier deaths turned out not to be COVID-19 positive. The State Bureau of Laboratories reran the specimen and it came back negative, and so that death has been removed from our countywide statistics in terms of deaths. We'll get to you later on, I believe, with a press release explaining some information about how that came to be. We're kind of digging into that right now. I do know this particular individual was tested twice. One was negative, one was positive before the death, and so I'm guessing that may have been what prompted the State Bureau of Laboratories to rerun the specimen. We are actively monitoring 293. We have recovered 60, 23 in the hospital, 4 of those in ICU, and the remaining are at home. So this is what that looks like on a graph, recovered deaths and cases. And then this is our current incidence curve, which gives you the number of new cases reported on a day-to-day basis. I would caution you that today's numbers are always ones that we pull earlier in the day, and that we do get additional cases reported to us through the disease surveillance system throughout the day that then get attributed to the day before. These are our cases by zip codes. So you can see the greatest frequency of our cases are in 48911, followed by 48823 and 48910. And then the rest of these, as you can see. Once we get to a point where we can give you a map of cases in these zip codes, we will do that. The issue with doing maps at this point in time is that if you have one case in a zip code, that's information that we consider needs to be suppressed. And so we will map as soon as we don't have to suppress zip code information. Our cases are split even, male and female. Distribution by age, we still are seeing the 50 to 59 age group being our highest rate of COVID-19 illness. Again, when it comes to COVID-19 deaths, we do, like the rest of the country and the state, see that to be higher. Here's our prevalence rates by race. So our African American population still having a rate per 100,000 that is 2.5-ish times, not quite 3 times, which it was last week, what our Caucasian population is. So here we are in looking at that by percent. So 63% of the cases are Caucasian, 25% Black or African American. That's why we adjust for rate when we do those calculations, because our African American population is a smaller population. So we can never look at just percents, we have to look at rates. Percent hospitalized, 11% of our cases are hospitalized and the other 89% are not. And then the status basically breakdown: hospitalized, ICU, recovered, deceased, and at home. So 64% of our cases are at home. So let me get out of that and start sharing some information on modeling. So, modeling. First, Mathematica, which you see here, is kind of got a repository of different kinds of modeling data policy resources. So they have curated a number of different sites that are doing modeling, that are doing data, that are providing resources regarding policy, identifying at-risk populations. So if you go to the Mathematica site, you will see this curated information. One of the other sites that I like to use, oh, here are projections. So then this is a modeling that has been widely used. It's the IHME modeling that comes out of the University of Washington. It is not available on a county level, but it is available on a state level. So when you use that modeling, which has been one of the highest touted ones, and they continue to upgrade these models so that we get a better projection. And this model has resulted in some downgrading on a continuous basis about the impact in the United States, which should be evidence to us that the social distancing policies that are being put into place by a number of governors, which have at this point in time impacted a significantly large percentage of the population in the United States, is working. So you see all resources. Then we can look at just beds. We can look at ICU beds and the possibility of exceeding our ICU bed capacity if we don't work a little harder. And then also basically invasive ventilators. So that is the IHME site. Then this is COVID Act Now. So basically this can give you information by county. This shows Ingham County with 3 months stay at home, lax, 3 months stay at home strict, and available hospital beds. So I think we are in a fairly strict place right now. I don't expect it to last for 3 months. What that tells us is that when we come out of the stay home, stay safe order and the sheltering orders, we are going to have to open gradually, and we are going to have to continue to be cautious about social distancing, large gatherings, crowded places, as well as hygiene and other sorts of practices. This website is from basically the University of Michigan. That's the one I told you about last week, which is this GitHub site. So if I go here, I can go straight down to Ingham County. And it takes a little while for this to populate. But then what you can see is, here's our map of Michigan. Here's a forecast for cumulative lab confirmed cases with a best fit line, which is the solid line, a median line, which is the dotted line, and a range from top to bottom that is the gray shaded space. So that's where we are right now with that. You have a 3-week forecast as well of cumulative lab confirmed cases that is over. All of you are in my way here right now. I gotta move you. So cumulative lab confirmed cases 3-week forecast. And then we have cumulative lab confirmed deaths. Again, a 3-week forecast, with this being our best fit line, and a current hospitalized patients 3-week forecast. Again, with this being our best fit line. When I went to that curated website to look at data sources, I also found this one, which I found useful. So you can see here that that gives us information about positive and negative tests hospitalized across the state, in the ICU across the state, on ventilators across the state. So, and then statewide deaths. And these are, I believe, yesterday's numbers. These are not today's numbers. And then one of the sources that I like to use frequently, ignore the advertising going on, I don't know what it's related to, is the Worldometer, or Worldometer's site. So if you scroll down to the bottom, you will see that the sources they use are reliable sources. I'd have to go all the way down to the bottom to find them, but they use the World Health Organization as well as CDC information and others to create their graphs and information. And so there's a lot of good information on there that you can look at worldwide in the United States. You can go here to this table and sort, as I told you before. We have to do rates. We can't compare across populations that are vastly different without calculating rates instead of just the number of cases. So when you sort this worldwide by total cases per million population, you see the United States down here. When you see total deaths per million population, you also see where we are relative to that. You can go back up here and go to countries and get yourself to the United States. And then let's see. Oh, here we go. And click on our own country. And then we're going to see our own cases by country as well as by state. And again, I would encourage you to go over here to these columns, which right now are not sorting because it's not working well for me, but these you can also sort. As I told you, is important to do. So when you sort by total number of cases per million population, then we see Louisiana that is basically, been having they kind of have been rising up due to some issues that happened down there around Mardi Gras, and I think they were very, very late in doing a shelter-in-place order. So again, looking at strict number of cases without counting for the population in any given state or any given country gives us kind of a skewed impression of what's going on. If we do look at deaths per million population, then you will see Michigan is still high in deaths per million population, exceeded only by Louisiana, New Jersey, and New York. So those are the resources that I tend to use. And that is where I'm going to stop today and take questions from all of you.
Okay, we have Kyle Kaminsky on the line.
Hey, Linda, in terms of recovered cases and how that's tracked, I know the state does 30 days after the onset of symptoms. What's the criteria for Ingham County on the number that's being reported online?
So our criteria is truly recovered people. So it's people who are asymptomatic for 72 hours. So 72 hours asymptomatic, or 7 days from the onset of symptoms. So there's the possibility that somebody would be ill only for a day or two. We still wait the full 7 days. Otherwise, we wait until the end of symptoms and then go 72 hours. We consider them recovered. We're in disagreement right now with the state's definition. They have explained why that definition is what it is and fits in the vast majority of cases. A lot of that has to do with the ability to clear cases in counties that are impacted with thousands of cases, and being able to track that and find out and make those calls to figure out who's asymptomatic. So they just set a bar. I can tell you that we have an individual in Ingham County that is in the hospital and probably is coming up on almost a month of having been in the hospital. So to say that she's 30 days post onset of symptoms and alive, which is what the state's definition of recovered is, would not be in my mind considered, a recovery in her case. She's still in the hospital. So to the extent that we can still do that, we will continue to identify recovered cases in our county in the way that we are currently identifying them.
Got it. Thank you.
Mm-hmm.
Okay, Rachel Sweet.
Hello there. So today was one of the worst days for deaths. Why do you think numbers keep going up after a few weeks of social distancing? There's a lot of people on social media says it's because they think that the social distancing is not working.
Well, that's not true. If you look at these curves and these numbers, so social distancing is working. Incidences, daily case counts are flattening out, which is what we would expect to see. You have to realize that deaths are going to lag behind incidences. So we have people in the hospital who have been in the hospital, and some of those people are not surviving. And so you're going to continue to see those numbers increase or not necessarily stabilize for a period of time while we still have a great number of people reported each day as ill and in the hospital for prolonged periods of time. So that really is just it has nothing to do with social distancing not working.
Okay, we have
Okay.
Megan Banta.
My
You get a follow-up, Rachel?
just my internet cut out a little bit. I missed part.
Well, your internet is still cutting out because we can't hear you repeating your question. So we'll come back to you.
Okay.
Okay.
Great. Go ahead, Megan.
So we heard from U.S. senators that there should be about $950,000 coming to the county, I think through the CARES Act. Do you know when that's arriving and how will you all be able to use that money for?
So that $950,000 is specifically for federally qualified health centers. So Ingham County is a health department, and we are also a public entity federally qualified health center. So that money will be used in our primary care clinics to do the work that they're doing, PPE, supplies, all of the things that they've been doing to take care of patients. So that is not public health funding, that is clinical federally qualified health center funding, whether it's supplies, provider pay at a time when revenues are clearly down, just like other primary care clinics. We are not doing, unnecessary non-urgent visits. We've cut down way on our visits, which cuts way down on our revenue coming into our clinics. At the same time, we have our staff still working very hard. And so that puts us in a position of having to, figure out where to find the balance on that. And some of that money is for that. So it's for, testing, it's for supplies, it's for just maintaining our clinics so that we can continue to serve the public in the ways that we have.
Okay. Rachel, did you want to try again?
Yes, I've switched internet. So, okay. So what did you say about the social distancing, about how it is working? Because some people are saying it's not.
So social distancing is working because you can see that in daily incidents. In other words, the number of new cases per day that are reported. If we had not done what we did with regard to social distancing, you would see those numbers continue to climb on a daily basis. You see that in other places where they did not implement social distancing sooner. So it's fairly clear. So the death data, it lags behind that incident data. So people are getting in the hospital ill, they're being cared for a period of time. Sometimes it is a while before somebody becomes ill enough that they finally succumb to the illness. So we're doing our best to help people recover, to save their lives. It's, I would say in Ingham County going quite well. It's not going well in other places where their hospital systems are overwhelmed. So if the hospital systems are overwhelmed, you see more deaths. So Detroit has got a hospital system that's overwhelmed. And so a lot of those deaths are coming out of there. If you look across the state, though, you see a flattening of the curve, and you should expect those daily death counts to lag behind in terms of starting to go down relative to daily incidence of cases.
And do you think that when do you think we'll start seeing a down curve?
I don't know. I don't have all of the statewide data, nor do I know the condition of people, in the Detroit area in terms of how many of them are in ICU, on ventilators, that sort of thing. A lot of those things can be an indication of the severity of illness. I can tell you, though, that it is not a guarantee death sentence, which some people think it is, to go into ICU and to go onto ventilators. We in Ingham County have seen people go into ICU, go on to ventilators, come off ventilators, come out of ICU, and go home to recover.
Thank you so much.
Mm-hmm.
Okay. Abigail, go ahead, please.
You mentioned the University of Michigan model, and their 3-week forecast shows that Ingham County could have upwards of 1,700 cases. Are you putting stock in a particular model, and when will we reach our peak?
Those are all good questions. So that model, I think, shows us, are you talking about the median line?
Yeah.
Yeah. So, that is actually a fairly good looking line if you ask me. So, and that is projected out a number of weeks. It's really hard to tell. I mean, we're looking at these models, the COVID Act Now model, the University of Washington model, and you just got to look at all of that and then get a sense of what's going on every day. And keep in mind that even the models change every day as new information comes in. So I'd like to give you an answer to that, but I just don't know. We're using the models to give us the best sense that we can of where we're headed, how much more we might need to do in order to keep our hospitals at a capacity to where they can continue to save lives.
Do you have a range of dates at all that you're projecting for a peak, or?
No, I don't.
Thanks.
Okay, David Ackerley.
Hi, Linda. On the county zip code breakdown that you gave earlier, it looks like the largest number, or the area with the highest number of cases so far, is Southwest Lansing, and adjacent to that, all of the 48910, which is, well, the rest of South Lansing, and then it breaks down to East Lansing and Mason. So any rhyme or reason to what you're seeing and those kind of hot spots? I know you see you can't get down to where there's like one case because it might be identifying, but when you look at that, is there anything that stands out to you?
Well, first of all, we're early and we have small numbers, so it's hard to make a real good guess at what is a hot spot when you're dealing with 240 cases. 240 cases in a county of over 290,000 is still small, and yet this is very serious and severe. I don't mean to understate that at all. So, it's a little early to use that information to start making those analyses as to what it is that might be going relative to hot spots. We do know, as we've talked about, and we now know that the governor has stood up a task force about the disparity issue and the disproportionate impact on people of color. I believe if you looked at 48911, you might find that that is one of our zip codes where we have a larger percentage of people in poverty and a larger percentage of African American population. When I go out to 48910 would be probably similar. I'd have to look at another GIS map that overlays those two things together. But then when you get to East Lansing and Mason, hard to explain at this point in time. We could make guesses about things like we had a lot of students come back from spring break at a very, very critical time. So they've been all over the world. They've been all over the country. They came back. I don't know if that's part of it or not. I mean, we have got to continue to accumulate data before we can do a really good analysis of what that information is telling us. And despite the fact that we have great concern over the numbers we have and them, continuing to be reported every day and the number of deaths we could see, we do still have a small number in the county relative to our total population to be able to, do a lot of hotspot analysis. So we're early on in doing that, basically, is my bottom line.
Okay. Yeah, I was just noting that it's about 40% of the total, just those four. And I'm not sure how it rates out population versus the rest of the county. It just seemed a little bit high. All right, thank you.
Yeah, we'll be doing some more analysis of that as soon as we can. And like I said, mapping and yeah, looking at rates and things like that. Even within zip codes, it's important sometimes to go beyond zip codes and go to census codes, because there are zip codes in Lansing, for example, that come down into the core of the city of Lansing and then extend out into the Eaton County area. And so when you look at that zip code, and I don't remember right now what it is, one of my commissioners could tell me really quickly, and a couple are here, that zip code broken into a census tract will show you that there's a different story in parts of that zip code than there are in other parts of it.
Very good. Thank you.
Mm-hmm.
Okay. Kyle Kaminsky, are you still on the line?
Yeah, my question's answered. I'm good. Thanks.
Okay, very good. Thank you. Next, we have Rachel Sweet.
Hello there. I have some questions from a viewer. People are saying that they're upset about the stay-at-home extension, and they're wondering how long do you think that the order should go? Do you think that summer vacations are possible for families?
Well, I think the order extended to April 30th is absolutely essential and absolutely a wise move. Whether we extend beyond that or not, again, you cannot tell until you look at the numbers. I think right now the governor's order is extended to the extent that the legislature extended her state of emergency, and that is where her executive powers lie, is within that state of emergency to do some of these things. So those two things may very well be tied together. As far as summer vacations, I think when, and I can't tell you when that will be, certainly by, the end of April, we might start this reopening process. A reopening process will not be everything goes back to normal. It will require social distancing. It will require restrictions on large gatherings. It will require restrictions on capacity in places that tend to get crowded and be elbow to elbow. It will require all of those things to continue for a period of time. That said, travel doesn't tend to be, a lot of people elbow to elbow, although you are on a fairly small plane if you're going to travel that way. It's really going to be up in the air in terms of travel, but we're just going to have to see what that guidance looks like in terms of reopening and the ability to say that we're kind of all clear to travel, because we got to take a look at where we're traveling to and where we're traveling out of, and how much might be going on in certain epicenters, despite the rest of the state or the rest of the nation calming down. We're going to have some epicenters that will take longer to come down than people who did not reach that kind of levels. So
Thank you.
yeah, sorry.
And then, well, for traveling, like you were saying, some people are saying that they're upset that they can travel up north but can't stay up there. What would you say to them?
They can travel up north but can't what?
They would travel up north but not stay in their up north homes, or be able to stay in their cottages and stuff.
Well, I will repeat what the governor said, which I think was very, very reflective of exactly what all of the different except fors, So the more you go, well, except for traveling to your house up north, except for golfing, except for fishing, except for the gardening, landscape industry, whatever. What that does is create pores. It makes this stay home, stay safe order porous. So the more you create those exceptions, the more you have pores in the system that basically continue to create problems that cannot be managed and contained. So that's the bottom line, is every one of those exceptions creates a porousness in the system that is going to be detrimental to us in the end. So everybody needs to hang tight. It's April 30th. We can do that.
Thank you so much.
Mm-hmm.
Okay, Abigail?
The CDC, director of the CDC mentioned yesterday that, when we do eventually get to the phase where we are reopening places like our counties, that there will need to be robust contact tracing. Is Ingham County in a position to do contact tracing, and how many people would you need per case working on contact tracing?
Well, contact tracing, first of all, we're doing contact tracing right now still with every one of our cases, every one of our active monitoring. So if you look at those numbers, we are doing contact tracing. So we absolutely have the capacity to do that. What we expect when we come out of this peak is that we will actually have less cases per day. And so that contact tracing is about to get easier for us, not harder for us. It's just going to go on for longer. So I think I referred to this last week, and again, I will tell you, take a look at this article called Coronavirus, the Hammer and the Dance, and understand that when these suppression methods, shelter in place, stay at home, lockdowns, when those end, that's when we get into what we call the dance phase of that. And so there still will be cases, and and we will continue to deal with this until we get to a point of a vaccine, which is why that reopening has got to be gradual. So if we keep case counts down during that dance period, then we can contact trace. And in fact, we can go back to what we were trying to do when this first erupted in this nation, and that is to contain it through isolation and quarantine measures. When numbers are small and easy to identify and easy to get contacts and do all the tracing for, we can quarantine and isolate those people, and we can keep other people from being exposed. And that is actually when we're going to be able to get more effective at that again, is when we get into that dance and continue contact tracing, social distancing, avoiding large gatherings, hand hygiene, all of these wonderful things we tell you in order to protect yourselves.
And just a quick follow-up on that. Do you know how many people are contact tracing for you all right now? And will you be releasing potential sites of spread?
We would release sites of public spread if we needed to, yes. Although we need to understand right now we have community transmission. And so it doesn't really matter where those sites are right now. We have cases that are being identified that have no known contact to any site, any person, anything, any travel history, right? So we need to be aware of that, and we need to take precautions accordingly, as opposed to thinking that we can avoid a hot spot. Remind me the rest of your question.
Do you know how many people are doing contact tracing?
We have 4 disease control nurses that typically do it. We added another 10 or 11 of our other public health nurses, and have added some environmental health staff, as well as a few others. So we are probably well into the 20s of people that are currently doing contact tracing for us.